Now, health matter, if no be health matter, if no fit be health matter, trust me, one of the most informative shows where they happen every Saturday across the channels, but most importantly on top your #1 family entertainment channel. We always tell now say health now wealth. Money no fit buy good health if it's not properly managed. Now the cocoa be that, person where they struggle with in heart and he get the money, but nobody's there to even, I mean, a kidney I won't even talk about. But one of the reasons why this show they very informative and the fact say doctor they call your awareness to so many things. So if you don't even know, especially waiting be start with last week will be silent killer. We be say most people they walk about with them. And guess what? Today is also a very special day because we celebrate our 5th anniversary of Health Matter. Ladies and gentlemen, our doctor, of course, my word, we need doctor. It's right here in the studio this morning. Dr. Barth! Congratulations.
Good morning.
Sir.
I'm glad to be here with you today.
As always.
You're looking sweet.
Doctor,
beaming out lovely smiles as always.
We are celebrating. I have to come prepared.
Thank you very much. And of course, to our numerous viewers at home and around the world, what can we say? But thank you for sticking with us in the last 5 years.
Yes, so.
Thank you so much. Thank you so much. Thank you so much. And it's on that note that I want to say a very good morning to you all and welcome you to today's program. We are continuing from where we stopped last week, which was, our topic was hypertension, the silent killer. Okay? And this morning, we want to be a lot more practical, okay, in talking about things that we need to do to prevent ourselves from developing this medical condition, okay? Yes. Now, we'll be talking about the definition. We'll give an overview of what hypertension is all about. We'll talk about the types, signs and symptoms. In most cases, we have been told that it could be asymptomatic. How is it diagnosed? What do we need to do? How do we know? Usually we hear the slang, knowing your numbers. What can we do to know our numbers? Do we just have to stop at knowing our numbers, or are there actions we can take? All of this and many more you will hear in the course of today's program. Okay, so let's start by looking at WHO fact sheet, okay, concerning this all-important topic of hypertension. According to WHO, about 1.28 billion people are living with hypertension globally. 1.28 billion people. That's the latest figures from WHO are living with hypertension globally. Okay? And more than half of these people are unaware that they have hypertension. 46% of them are unaware that they have hypertension. Surprisingly too, why are they not unaware? Because it shows no symptoms most of the time. Okay? Only 42% of people that have hypertension are receiving treatment. And out of these 42% that are receiving treatment, only 1 in 5 have their blood pressure under control, regardless of the fact that they are receiving treatment. So there is work to be done by everybody. I also would like to point out that 2/3 of 1.28 billion people that have this medical condition are found or are living in low and middle income countries, which of course Africa falls into. And all over the world, hypertension has been identified as one of the major diseases that can cause premature death. And of course, we need not be told that hypertension is a risk factor for not just cardiovascular diseases alone, okay? It is a risk factor to the development of stroke, risk factor to the development of chronic kidney failure, risk factor to the development of heart failure, risk factor to the development of even vision challenges. Oftentimes, it may end up as blindness. So, what is hypertension? First, let's start by looking at the heart. The heart is a muscular pump that each and every one of us have. And usually, it is about the size of a clenched fist of such an individual, usually found on the left side of our thoracic cage or cavity, if you like. It's a muscular pump that pumps blood to all over parts of the body. It pumps about 5 to 6 liters of blood in 1 minute.
Wow.
5 to 6 liters of blood. A liter of blood is about, for people who live in Nigeria, a liter of blood, a liter is about 1,000 mils. And 1,000 mils is the equivalent of having 2 sachets of pure water. Okay, 1 sachet of pure water is about 500 mils. So imagine having a heart pumping about 12 sachets of pure water. I'm using this as an analogy, in just 1 single minute.
Wow.
And the heart beats about 100,000 times in 24 hours in 1 day.
Wow.
Okay, so you can see that is a pump that it is heavily and constantly working and active. Okay, now when the heart pumps, usually blood pressure is recorded in 2 readings, one above and the second one below. Okay, so when the heart pumps blood, the pressure when it is pumping blood is regarded as a systolic value. Okay. When the heart relaxes in between beats, the pressure at that time does not return to 0, is regarded as a diastolic. And occasionally you could have both pressures going above normal limits. In some cases, it could be isolated, in the sense that you could have the systolic value becoming abnormal while the lower one is within normal limit. If that happens, we could have what we refer to as systolic hypertension. In some other cases, you could have the diastolic going above normal while the upper one, the systolic, is within normal range. In isolated case as well, that can be called diastolic hypertension. But most cases, the 2 readings are usually elevated. And what are these 2 readings? Now, let me also talk about what hypertension is all about. It is the force of pumping blood, which we refer to in medicine as the cardiac output, against the pressure that are found in the arteries. Arteries are blood vessels through which the blood are distributed to all parts of the body, kidneys, hands, and legs. Okay, so there is a pressure that the force moves against that are found in the arteries. We call that total peripheral pressure. So when it moves against this force, what results? The resultant force is what we regard as blood pressure. And over time, this blood pressure could become abnormal. And when it becomes abnormal, it begins to damage the blood vessels slowly over a period of years. Okay. And when this happens, what happens is that the blood vessels will begin to become narrower. They will stiffen, become a lot more hardened as a result of the deposition of plaques, usually as a result of caused by cholesterol deposits within the lumen, the opening of the blood vessels. This continuous narrowing will further increase the degree of force the heart will need to pump more blood. Okay. Remember, the heart pumps blood through blood vessels, usually the arteries, that are found virtually in all parts of the body. The damage that can happen in these arteries over a period of time, if it happens in the brain, the blood supply to the brain could get narrowed, could get reduced. In some cases, it could burst as a result of the weakness. And when that happens, such an individual will end up with stroke. It could happen in the eyes. Slowly, it could cause vision changes, which oftentimes may end up as blindness. It could also cause dementia. That's what we refer to as vascular dementia. The individual begins to lose his ability to think. Cognition challenges can also be caused by hypertension. If the blood vessels get narrowed, and the blood vessels that supply the heart, the coronary artery that gives heart the blood supply to the heart itself, if it gets blocked or gets damaged, that area that is deprived of blood will become ischemic. and such an individual could end up with what we refer to as acute myocardial infarction, heart attack.
Wow.
It could also cause challenges in the urogenital system of the human body. If it happens to a man, it can cause erectile dysfunction. So it affects virtually all parts of the body where you have blood vessels. It can affect the legs, the vessels in the legs, and can cause all sorts of problems. And what is this hypertension? Hypertension is a medical condition where you have your blood pressure being elevated to abnormally high levels.
So when you say
usually, yes, it's abnormally elevated and is sustained over a period of time. Before now, we are used to having a reading of 140/90. Anything above 140/90 millimeters of mercury is regarded as hypertension. But newer guidelines have actually come out. According to American Heart Association, we can see that on our screen now, where we regard as going above before is now being regarded as stage 2 hypertension. Okay, so the normal reading, the target that everybody should seek to have is to have a BP of 120/80 or less. That is what is taken.
Okay, if it's less, it's
yes,
not a danger.
Normal BP now is between 120/80.
Okay.
Now you start talking about elevated BP. If you have a reading of systolic 120/129 and diastolic 80 millimeters of mercury, and of course stage 1 hypertension is showing on your screen. And of course you can see if it goes above 140/90, we are talking about stage 2 hypertension. So more or less the goalpost is beginning to change.
Stress.
What are the types of hypertension? Usually we have 2 major types. Okay, you can also talk about a third type, in which case you could have pregnancy-induced hypertension that we talked about last week. Now these 2 types of hypertension are primary hypertension and secondary hypertension. Primary hypertension is responsible for 90% of cases or more of hypertension that we have globally. And these are usually related to genetics and lifestyle, unhealthy lifestyles. These are the ones that do not have reversible causes. Okay, so that's what we regard as risk factors for the development of primary hypertension. We'll come to that shortly.
Okay.
Secondary hypertension is less than 10% of hypertension that we have in the population. And these are usually as a result of an underlying medical condition, which can be reversible in some situations. When that happens, one can actually have the hypertension resolved over a period of times. And what are some of these things that can cause secondary hypertension? You have secondary hypertension, we talk about kidney-related problems. There are very many of them. I don't want to bore us with the medical name: chronic kidney disease, renal artery stenosis, and what have you. Endocrine-related problems too can cause secondary hypertension. The use of in some women, the use of contraceptives. Thank you very much. My slimmest. Minus E. Thank you very much. Can also predispose one to secondary hypertension.
As Doctor will continue, definitely we'll open our phone lines so that now when they watch us for house, you get questions where you go like ask Dr. Barth. You know, some persons don't live with this silent killer for the past 30-something years. Waiting they feed do. Is there even remedy? Is there a way out of this, or you have to live with it for the rest of your life? I know you get bugging questions this morning. Please feel free to call those numbers waiting on your screen. And of course, like we always talk, please make use of our WhatsApp video calls. Dr. Gwonsi, I don't think they've called Dr. Barth on this screen. So please feel free to use our WhatsApp calls. Call us so that we'll fit see your face. And of course, Dr. will fit also relate with you this morning. And Doctor,
yeah, thank you very much. So before we went on the short break, we were talking about primary or essential hypertension. I said usually 2 major types. Okay, the primary or essential hypertension, which is responsible for greater than 90% of hypertension cases globally. And of course, I did say that the cause for this is not known. In medicine, we refer to it as unknown etiology. Okay, so secondary hypertension usually may have a reversible cause, an underlying medical condition that may be responsible. And I mentioned one or two of them that can be responsible for the development of hypertension. Okay, diabetes is in that category. Okay, kidney associated problems, chronic kidney disease, renal artery stenosis, and what have you. And of course, some other endocrine disorders, Cushing syndrome, adrenal thyroid problems. Okay, so but like I said, we'll dwell more on what we need to do. Okay, so let's go back to primary or essential hypertension and look at the risk factors and what you and I need to do to avoid or to reduce the odds or the risk of developing hypertension later in life. Let me start by saying that I will categorize them into two: modifiable risk factors, the ones that you have is say that you can do with lifestyle adjustment and interventions or modifications if you like, and of course the ones that you have little or nothing you can do about them. Okay, so let's start with the ones that will have power to affect.
And Friday's calling on a Saturday. Hello, Friday. Good morning.
Good morning.
Good morning.
How are you
sir?
today?
How are you?
I'm fine.
Please go on with your question.
Good morning, doctor.
Yeah, good morning, my brother.
Last week I wanted to call you, but my call did not go through. What you are saying...
I'm happy you got up today.
Yeah, I have a similar problem of what you are saying, but I don't know. I don't even really know what is wrong with me. I went to the test center 3 days ago. So they tested me because I was complaining of this bad breath.
Okay.
Bad breath. So I don't know what is really causing it. When I wake up in the morning, I always feel my system is not okay. I'll just be perceiving odor from my body. So I went to the health center. They tested me. So they checked my blood pressure. They said my blood pressure is 100 to 150. So they were asking me maybe I have an ulcer. I said I don't know.
Come again. Your blood pressure was what?
100 to 140.
Okay.
So,
100. It should be 140 over 100.
Yes.
Okay, thank you. I need to get that right.
So, but the problem I'm having is that
how old are you? How old are you, sir?
I'm 51 years old.
Okay, thank you, sir.
But the real problem of the thing that I'm always persist for is that that thing is causing bad breath and body odor. So I don't know the cause of I don't know what is really causing that this thing. The moment I near with people, even though I rub even though my perfume will not be smelling nice, I don't know the problem. I don't know what is causing it.
Thank you very much. Thank you very much. I feel your concern. And of course you're not comfortable with it. Okay, so let me start with where you ended. What could be responsible? Halitosis is the medical name for that. Usually it could come with complications that may have to do with the ear, the nose, and the throat. Wow. Okay, so in this case, you need to see an ENT specialist. Okay, so you need to be further evaluated. Oftentimes people think because one may not have brushed his or her teeth very well, that could be, no, it's far from that. Even if you like, go and use the best of toothpaste, the most expensive of them all, the problem will still persist. Wow. I think you need to see an ear, nose, and throat specialist. Sometimes congenital malformation can occur. I've seen a patient that told me that occasionally, if the person strains to cough, it can cover debris of food that he or she ate like 3-4 days ago. You can imagine if that is still retained in someone's system, that could give a problem kind of like smell you're having. Okay, because it's not at a place that you can access it to remove it. It's usually when she coughs hard, she said, that she can actually produce it. And she says she does that all the time. Okay, so I think you need to be further evaluated. That is on that side. And then the B part is your BP. That has to do with what we are discussing today. At 140/100 millimeters of mercury, with the new guideline, you're already on stage 2 hypertension. Okay, regardless of any guideline you're looking at, you already have hypertension. And what anybody needs to make a diagnosis of hypertension is to have an elevated readings that are taken at least a day apart from each other. Some literature say at least 4 to 6 hours apart. Okay, but let's use a day apart. If you have a reading that is elevated today and then tomorrow, you probably check it yourself or probably return so that a health professional could help you do that. If you have a reading that is elevated and sustained, we are talking about hypertension, and you need to take measures to reduce your odds, your risk of developing complications that can occur with hypertension. Don't just relax because it is showing you no symptoms and you said, no, because I'm not feeling any symptoms, it's not enough to relax because you're not feeling any symptoms. So you need to start doing something about it. Okay, and we're going to hear some of the things that we need to do to reduce our odds of developing complications few years, 5-10 years down the line. Okay, so let's go back to primary and essential hypertension and let's look at the risk factors. I said we'll be looking at them in 2 categories, modifiable as well as non-modifiable risk factors. The modifiable risk factors, I want to start with salt intake. Salt intake. I really want to dwell on this topic today. If that is the only thing we can take home, we'll have another caller. Good morning.
I think it's the same Friday. Friday, you called back, Abby?
No, this is another
Friday. Wow. And that one too was from Cross River.
Thank you very much,
Thank you, Friday.
One Saturday should call us. That was on the lighter note. Please go ahead.
Another Friday.
Please turn down your volume.
All right. One Saturday should call us.
Wow, that's loud. Reduce your TV volume.
Okay. So, the reading I had a test yesterday.
Okay.
I had a test around 1% test yesterday. At chemist. So the test, the result is 110. So over 78. Around 1% test yesterday. At chemist. So.
Okay, go on.
Any other question?
Yes, we got that. Sure, he wants to know if he's normal.
Okay, thank you very much. Our second Friday this morning.
From the same place.
Thank you very much. 110/78 over 70 millimeters of mercury is good enough. Okay, so you're good, but you should keep an eye on this. Sometimes I get this question: how often should one check your BP? Okay, depending on your age. Okay, but if you have some risk factors, which of course one of them is family history of hypertension, in fact all of us should check because race is another non-modifiable risk factors. So we are all blacks in this part of the world. African Americans too are known to have hypertension more than any other races. Okay, and also we are known to have severe outcome when we leave them untreated over a period of time. Okay, so race is one of them. For the fact that you and I are blacks, okay, so it predisposes us to developing hypertension. That's one of the non-modifiable risk factors. So back to salt.
So, yes. Sorry, doctor, just on what you just said now. So when do we consider it to be very low? Because I was thinking, since you said 120/80 to be normal, I think I was hoping to. Okay, Samson. Hello, Sammy from Abuja. Good morning.
Good morning, ma.
Good morning, sir. Good to have you. Please go on.
My own is that sometimes some weeks ago, I did not feel any symptom. I just decided to go to and take my blood pressure. When I went there, it was 180/120. When they asked me that did I come by myself, I even checked to the hospital myself. They now place me on medication. They say I should go and do free fast sugar test. I do that. The sugar is normal. Then I take the chest X-ray. The X-ray is normal. Then I take a EDC. when I left the EGC, they now say that I have some
ECG.
I did the left ventricle is
Okay.
enlarged. Although I used to play active football before I.
How old are you, sir?
Exercise. I'm 46.
Okay.
Then I had been on drugs, but sometimes if I take it, it will be that brought to 120 over 90. But there's another test they queried. So when I went to where I went to, they said I can't get it there until I go to main town. So that is what I'm facing right now.
Thank you very much for calling in. Thank you very much for calling. Last week we talked about hypertensive crisis. The reading you just gave us is within that domain. Any BP that is above 180 above and 120 below millimeters of mercury is regarded as hypertensive crisis. And under this hypertensive crisis, we have two categories, have two subdivisions: hypertensive urgency and hypertensive emergency. Okay. Now, yes, hypertensive urgency is when you have BP this very highly elevated to a dangerously high level, but has not started causing end organ damage, which can occur in the brain, in the eye, in the kidneys, and sometimes in the cells of the gonad. Okay. Hypertensive emergency is when you have BP this elevated and there are already signs of end organ damage. It has caused chronic kidney disease, CKD, which usually will progress to, if urgent measures are not put in place.
Doctor, what's up with Friday?
Friday from Lagos. Good morning.
A third Friday.
Is your day today?
Wow. Good morning, you.
Good morning.
Good morning,
thank
sir.
you very
Please
much.
go on. Good to have you.
Please, I was listening to television and I was hearing about the doctors talking about the hypertension.
Yeah.
Yes, we can hear you, sir.
I want to know if you have your BP is high to 140, 90, and you are placed on a particular drugs, and that is taking the drugs, and maybe after sometimes you look at it, it's reducing. After sometimes the BP is coming down, and you stop it for a while, and you see it started to shoot up again. In that case, what one will do?
Did you get the
Okay,
question?
thank you. I got your question. Thank you very much for pointing out that. And that will also take me to something I need to talk about. Okay, the fact that if you're started on BP drugs, you cannot just stop them abruptly by yourself. Okay, you need to work hand in hand with your doctor to know if you can actually stop them. Okay, what usually the narrative is that when you start taking the BP drugs, normally with lifestyle interventions, that you can combine both. When you start exercising, we're still going to deal with it. Okay, so your BP will naturally start dropping. It drops to a level that you're comfortable, and oftentimes will start becoming non-compliant with our BP medications. Okay, so that can happen. And it does not stop there. Sometimes some people will stop it abruptly for some days. Yes, you may stop for like 1 or 2 days and you measure it regularly and you still get high reading. But by the third day, I can tell you that it can actually jump up again. I usually give my patients an analogy. Okay, so the analogy is this. I have a perforator in my office. Usually I will tell you, when you start taking your BP drug, because when you start taking the BP drugs, when you're started on BP drugs, it's like compressing something that has a spring, like that perforator. Once you put pressure on it, it puts pressure on your BP, it becomes normal. Okay, so when you stop taking the BP drugs, everything springs up again.
Yeah.
So that is what happens. Okay, so you need your doctor to be your guide in that. Okay, so you don't need to stop taking your BP drug. And so also this takes me to what we can, many of you who are on BP drugs may have noticed. You start being on a particular drug, it works excellently for you over a period of time. And after a while, the same drugs you were taking, the same dose, the same strength, it does not control your BP anymore. What that means is that the concept of tachyphylaxis has set in. So you need to see your doctor for your medication, BP drugs to be reviewed. The dose can be increased. You can be change to an entirely different drugs.
Okay.
Thank you very much. And I really want to go back to this salt because that's...
Doctor, you've not answered my question. When
Yes.
does it... Okay, so we finally have a
yes.
video call. Good morning.
Good morning.
Dark. Can you help us with the lights? So we can see your face.
Yes, I think I can see now.
Okay. All right, go on, please. Who do we have here? Hello.
Good morning. Good morning.
Yeah, good morning. We can hear you.
Yeah, I'm Mr. John from Abuja.
Mr. John from Abuja. Thank you for calling in.
Yeah. Thank you so much.
Yeah.
The intake of coffee.
Yes.
Yeah, the intake of coffee, does it cause hypertension too?
Thank you very much. I've actually gotten that question plenty of times on this program.
Okay.
And one of the days, I think one of our invited cardiologists actually answered it. Okay, so the answer is that it does not cause hypertension. It does not cause hypertension. However, there are diets that can predispose one to hypertension. Usually the Western diet
can
predispose one to hypertension. Okay, but the diet that we're advised to do is what they refer to as Mediterranean diet that has plenty of vegetable and nuts. Okay, in medicine we also have what we refer to as DASH diet. Okay, it helps in reducing hypertension. These are some of the interventions that we are going to talk about when we get to diet. Now, talking about salt, okay, salt consumption, we need to reduce our intake of salt. Recommended daily dose of salt that an individual should have will be about 1,500 milligrams, which is about half a tablespoon of salt. That should be spread over all the salts that the person will consume in a 24-hour period.
Wow.
And let me shock you with what I'm going to drop next. The greater percentage of salt that we eat comes from processed foods. I don't know if you can see that infographic that is currently being projected. Processed foods constitute 71% of salt that we get into our system.
Wow.
Okay, these are the sources of salt.
Already
sodium.
made food for those who don't
Yes,
understand.
packaged food.
Packaged food.
They contain, we get about 71% of salt from that. Okay, natural sources will give us 14% of salt. I don't know if you can read it very well. Natural sources will include things like vegetable, dairy products, shellfish, that can give us 14%. Okay, so home cooking and homemade food, home cooking and preparations will give us about just 6%.
6%. And
these processed foods are usually what we eat out, what we eat in restaurant, okay, and in a number of places. But in the house, the ones that are made in the house, we are looking at just 6%, okay. Added salt, added table salt will give us about 5%, and others will give us 1%. Averagely, an American consumes about 3,400 milligrams of salt per day.
Wow.
That is twice the recommended daily dose that an individual should actually have. So if you can work on your salt intake, it will do you a world of good. If you can work on your salt intake alone, that will do you a world of good. Don't forget, we did say that genetics and lifestyle lifestyle changes are actually what we need to work on to cut down on the risk factors that can actually lead us in developing primary or essential hypertension.
Remember, so you get the opportunity to call into the show for doctor to fit, answer your questions. Especially for those persons who be check their BP of recent, they confused. That now why Health Matter day there. My doctor.
Yeah, thank you very much. We are still on non-modifiable risk factors to the development of secondary or primary development of primary hypertension, also known as essential hypertension. We've talked about the non-modifiable risk factors are, of course, age. We cannot change anything about that. Race, because you and I are black, we are not Caucasians, we are a lot more predisposed to having hypertension than other people in the population. Okay. Another one that one can actually not modify is genetic. Okay. It runs in families, hereditary. There's nothing you can do about that. Okay, there's nothing anybody can do about that. But let's look at the ones that we have power that we can change, and we talked about them, diet, and we narrowed it down to salt. Okay, so diet generally, we need to do more of vegetables, fruits, and nuts. Okay, as against plenty of red meat. Okay, so we need to work on our diet. Very important. We need to do more of DASH diet. With diet alone, you can actually reduce your hypertension. Okay, so another thing is we need to avoid getting or becoming overweight and obesity. That's class 1, that's class 2. You need to check your BMI, have an idea of what your BMI is. A health professional can actually help you to interpret for you to know. We have dealt with that a couple of times on this show. Okay, so you should watch out for your BMI. That should be a tool that will guide you to know your category when you're talking about weight. Now, exercise is very important. Somebody described exercise as the best medicine ever invented to help humanity. What you need to do is to have at least 150 minutes.
Evelyn
from Lagos.
From Lagos. Good morning.
Hello, good morning.
Good morning, Evelyn.
Yeah, good morning.
Please go on.
Please, I want to ask something. When someone is taking hypertensive drugs and is planning to conceive, can the drugs prevent pregnancy? Because some doctor will tell you to continue taking it, and when you are trying to conceive, you will be finding it difficult to take it. So I want to confirm if the drugs can really prevent pregnancy, or you can still take it and have and conceive.
Thank you very much for that very important question. If you're on BP drugs, and you become pregnant, please rush to your doctor and let the doctor know that you have become pregnant. Now, the reason is simple. Not all the drugs is safe or are safe in pregnancy. Okay, so only about 2 or 3 drugs are safe in pregnancy. Okay, so if you know a drug called methyl dopa is very safe in pregnancy, I won't call the brand name so that we don't run foul of the rules. Okay, so that is safe in pregnancy. What the doctor needs to do is not to stop your BP drugs, but to alter it, to change them to those ones that are pregnancy friendly, if I can use that word. Thank you very much for that very important question. So exercise, you need about 150 minutes of exercise per week. Okay, so about 30 minutes over a period of 5 days. If you can actually do exercise, it will do you a world of good. Number one, it will reduce your weight. If you're able to drop your weight by just 1 kilogram, some studies say it has the capacity to drop your BP by 1/2 millimeters of mercury for people who have BP. Okay, so smoking you need to avoid. Excessive harmful use of alcohol is a no-no. I'm afraid
means you will still have to continue next week.
That anyway, is how far our time can take us.
Like we talked, so we celebrate with 5th anniversary on Top Health Matter with Dr. Barth. So we need to say a very big thank you to Grace Valley Medical Center. I mean, see our beautiful cake on the screen.
Wow.
Yes. Now let me actually make this cake available.
Thank you, Grace
Valley Medical Center.
Thank you very much.
And of course, thank you to Dr. Barth.
Thank you very much. And of course, to our numerous callers that called today, the 3 Fridays, Friday 1, Friday 2, Friday 3, Samson, Evelyn, and the man from Abuja, we
Mr.
appreciate
John.
you. Mr. John, we appreciate you. You guys have been wonderful. You've made our day. Thank you so much.
Thank
you. It has been a journey that started 5 years ago, and we never can tell how much more God can help us. We appreciate you.
Thank you.
We'll be back next week. Thank you very much.
Bye, guys.
Yeah.
Mama, papa,